Many of you have experienced stomach upset due to a strong state of tension. In some cases, stress causes abnormal stomach and intestinal movements, resulting in stomach pain, diarrhea, and constipation, and reflux esophagitis. Back pain. It is now known that the stress can cause back pain. In some cases, back pain is caused by orthopedic problems such as slipped or herniated disc. But if there is no such problem, but a slight pain that persists for a long time, chronic back pain caused by stress is suspected. Prolonged stress, depression, or anxiety can make it difficult for the brain to release dopamine, causing back pain to longer and even the slightest pain to be felt more intensely. Stress can lead to menopause, which can cause physical abnormalities such as hot flashes and mental symptoms such as irritability. This can be attributed to the negative effect of stress on the various mechanisms that balance the body, such as hormones and the autonomic nervous system. There is a symptom of the menopause: flushing, hot flashes, sweating, cold hands and feet, lethargy. This is a lack of energy and enthusiasm, tiredness, difficulty sleeping, anxiety, depression, irritability, headache, palpitations. This is a rapid, strong, irregular heartbeat. Stiff shoulders, joint pain, dizziness, tinnitus. This is a ringing or buzzing in the ears, memory loss, vaginal dryness, and sexual pain, and etc. Depression and anxiety. Depression and anxiety. Mental illness such as depression and anxiety disorders are also related to various types of stress. High stress can cause some kind of malfunction in brain functions, resulting in symptoms in the mind and body. Stress is an inevitable part of social life. It is important to occasionally check to see if you have accumulated too much stress and to take action as soon as possible. Depression can cause a variety of mental and physical problems. Physical ailments include sleep disturbance, fatigue, stiff neck or shoulders, heavy head, headaches, and etc. Mental ailments include decreased motivation and interest, decreased ability to work, depressed mood, anxiety, and over anxiety. Depression is an illness that is difficult for individuals to recognize. Without knowledge about the depression, a person may not be aware of depression even though symptoms are present. Also, in severe cases, the brain function declines and the patient is unable to recognize that he or she is ill. It is very important for family members and those around them to recognize depression before it becomes serious. Signs of depression that people around you may want to notice include talking less, being irritable, not feeling well in the morning or after a holiday begins, late or absent from work more often, complaining of lethargy, and organizing personal belongings, and so on. It is important to recognize the signs collectively and communicate them specifically to the individual in order to provide treatment as early as possible. However, focusing a patient to see a doctor may cause a patient to become even more depressed. It is difficult to communicate directly with the patient. It is acceptable to ask a family member, close friend, or someone in the patient's trust to communicate with the patient. I will talk continuous topics in the next section. I will talk about the patient's family care. When the family member becomes seriously ill, such as cancer or suffers from the depression, withdrawal, or other mental illness, or has a significant loss of life skills, such as aging or a period of rehabilitation for an illness, and must constantly take care of them. The patient's family is often described as a second patient. They are faced with many new challenges, such as monitoring the course of the patient's illness and administering medications and providing physical care and emotional support. Here is examples of the anxiety and the depression experienced by patient family. Constant worry, unwanted thought, feeling angry and irritable, cold sweat, difficulty concentrating, difficulty sleeping, always nervous and unable to relax, and less rest. Depressed mood, cannot enjoy anything, lack of appetite, cannot make decisions about things, self-blame, inability to concentrate, difficulty sleeping, lack of motivation, lethargy, tiredness, boredom with life. So major cause of the distress, not only for the patient, but also for their family, is the uncertainty and fear about the future, such as will the cancer recur or spread to other organs, how to support the patient, whether he or she will be cured by continuing treatment, or financial concerns such as treatment cost. These factors become chronic stress that affect the family members. In addition, because they are family members, they feel a strong sense of helplessness, saying that they cannot do anything to help. In the case of the patient is approaching the end of life, family members may have problems such as this decreased physical activity, weight gain, increased alcohol consumption, and inadequate self. After the loss of a patient, there is a grieving process. Grief can be emotional, like a depression, guilt, anger, loneliness, longing, grieving, and cognitive, obsession with the deceased person or denial, or behavioral withdrawal, and physical, the lack of appetite and insomnia. Some hospital provides the physical, psychological care for family members and surviving family members of the patient. So what happens when family member taking care of the patient feel emotionally burdened and unbalanced or worried about the future? If they are in a bad situation, they will look for a cure and go to the hospital to consult a doctor. The doctor will diagnose and prescribe medication. And after a few weeks, the doctor will say, how are you doing? Is the medication working? Then he would say, well, let's see how it goes a little more. And prescribe the medication. The process is repeated. It will be nice if it gets better. But if you get stuck in this cycle, it is likely to get worse and worse. This is because the treatment misses the point. There is no disease in human beings, but the way we communicate in our relationship results in disease. The disappearance of a mental illness means that the pattern of communication that produced a state of mental illness have disappeared. In this way, the communication within the individual and the family that needs to be improved. And even if you increase the medication or surgically remove part of the problematic area, the disease will recur again after a few years. This is because the root of the problem has not been removed. It can be anger or fear, frustration, sadness, or anxiety in the past, at present, or in the future. In the next topic, we'll explain the mechanism by which the disease appears.